Kia ora and hello, everyone. My name is Rachel Mukweza Tapera. I'm a research fellow at the University of Auckland, here in Tamaki Makoro, Auckland, in Aotearoa NZ. I would like to take this opportunity to recognize and acknowledge the indigenous peoples of this land, where I have the privilege to live, learn, and be nurtured. So today I'm going to be sharing with you part of my research that I did exploring the social effects of neurodivergence amongst African migrants here in Aotearoa. So before I go into the presentation, I just want to acknowledge the many people who contributed to this project. So first of all, the Tangata Whenua and Mana Whenua of this land. I would also want to acknowledge the participants of this research, the research advisory group, the various African community leaders. Thank you so much for making this work what it is today. I would also want to acknowledge the University of Auckland, the Department of Maori Health, and all of my colleagues and friends from work for your support through this work, and for my family as well for standing with me throughout this journey. So, just a brief overview of this presentation. First of all, I'll just share a brief background of this research. Well, just mainly just highlighting some of the key aspects of this work. So mainly deriving these from the title itself. I'll talk about the research questions and perhaps how this research was conceptualized, and then maybe talk also briefly about the methodology, how the research was carried out, and maybe some of the key findings and recommendations. So yeah, let's jump into it. I understand that this is a space where experts in neurodiversity are sitting, so I won't really give much of definitions, but just to acknowledge that neurodivergence is a complex and controversial phenomenon. So it is important to note that no two brains are exactly alike, and that any deviation from societal expectations of normality will be termed divergence, something that perhaps is problematic in its own nature, but also to understand that it's not all neurodivergence that is diagnosed or even diagnosable. Okay, so moving on to the next slide, just looking at the populations in Aotearoa. So Aotearoa is a super diverse nation in having diversity between and within population groups. So as you can see from this table here, that has data from censuses held in 2006, 2013, and 2018. So what you can see is that we've got mainly 5 ethnicity groupings, and then there's another one that is just labeled other, but we mainly have 5 ethnic groups. So in those 5, I think of particular interest in this project is the Middle Eastern, Latin American, and African group, which is a collective of culturally, linguistically, and religiously diverse communities. The aggregation of these ethnicities in this group is also controversial and problematic, contributing to some of the barriers that our communities face, especially with access to services, not just education and health, but all of the other social services. So what we know is that the African community or the African subpopulation group is the smallest in this ethnic grouping. So one of the reasons why this research was mainly focusing on African migrants was because of that, just that that is a very small proportion of the population. And then when we want to sort of look for the proportion of neurodivergent people in that population, it's actually very small, making that a minority of a minority, making it a very important population group to focus on, because they are very easily, they're very vulnerable to being marginalized as a group. So something else that I would want to make clear was that in this research, I was mainly working with participants whose ancestors originated from the African motherland, and they themselves identified themselves as Indigenous African. I think the main reason behind was that the differences in experiences, particularly with health services and all of those things, especially on the basis of race. So yeah, and also another reason was that Africans are a very vulnerable group, especially when we're looking at African populations that have migrated to other lands. They're a very vulnerable population group, often having experienced forced migration and complicated histories and journeys to get to their final destination. So in that regards, it was very important to consider issues around cultural safety in this research as well. Another last point to talk about when we're looking at the classification of African populations in New Zealand is that that Mela ethnic group that I just defined or described earlier also doesn't quite clearly elaborate who an African is. So according to Statistics New Zealand, African includes people who are Black African, who are Black British, African American, and Caribbean. However, people coming from North Africa, for example, people from Algeria, Morocco, Egypt, Libya, those people are classified as Middle Easterners. And then for other people coming from like the islands of Mauritius and Seychelles, those people are classified as other. So if you really want to sort of look into the MILA data and maybe try and, get data on African communities, whatever data you get might not be quite representative of the actual African populations in New Zealand. So that is a very concerning aspect that I thought I should highlight to help build a background or an understanding as to why this research was framed the way that it was framed. Okay, so now looking at the research questions. So there was a lot of gaps that this research could have focused on, but then I just tried to reduce the scope to just focus on these three or four points. First of all, just wanting to explore or find out the factors that influence the lived realities of neurodivergent Indigenous African migrants. Also exploring further how these factors impact their participation in society and access to services. The other point was trying to explore whether migration had an impact on African indigeneity. Indigeneity describing the way of being, the way that defines who a person is, their way of doing, their way of being, their way of thinking, the way of theorizing, and so forth. So just trying to find out, does migration impact on that sense of being? And then lastly, just wanting to see if at all, the implications of this research can contribute to policy practice and research. So those will be some of the recommendations that I'll share at the end. So this research was a complex undertaking that required careful planning and navigation. I would like to acknowledge the Research Advisory Group for guiding my thinking around the need for this research to be carried out in a way that is representative of Indigenous African communities, or something that our communities could identify with, however, without ignoring our rich diversity. And also being aware of the potential barriers to engagement given the sensitivity of neurodiversity and the stigma around that for some of our families. So exploring the experiences of neurodivergent African migrants in Aotearoa required an understanding into the influence of pre-migration and post-migration factors. So understanding the history of colonization and the legacies of Western research in Aotearoa and Africa that resulted in the devaluation of Indigenous ways of knowing, doing, and being. So it's important to understand the many layers of imperial and colonial practices underpinning knowledge creation and their impact on systems, policies, and health outcomes. So it was crucial for this research to identify suitable paradigms to firmly anchor the complexities of developing research whose physical setting and target community originated from very different worldviews and knowledge systems. So whatever paradigms were being applied to this research needed to be flexible enough to embrace the vastness of Indigenous theorizing. So it was critical for this research not to replicate the historical injustice or reinforce injustices against the Indigenous people of New Zealand, as well as the African people as well. So this research needed to be culturally safe, as I mentioned earlier, for the African migrants. As I said before, generally, ethnic migrants are a vulnerable group experiencing a range of barriers in most aspects of their lives. This made cultural safety a very crucial aspect in this research. So when we look at the methodology of this research, it needed to be relevant and applicable to Aotearoa New Zealand and contemporary health research as well. So after pondering and reflecting on the research aims, the cultural alignment, issues around, feasibility and practicality, and whether, what would be ethical, the African philosophy of Ubuntu was the foundation for this research. So this research is rooted in the African philosophy of Ubuntu. It is an ethical theory that is familiar across African societies. It is a philosophy of becoming human and is an expression of our everyday living. Ubuntu stipulates that we are who we are because of who is around us. This concept correlates with the Indigenous Holism framework by Absalon 2010, which stipulates that our relationships and our connections influence our realities and experiences. So any imbalance of any element in that framework impacts the functioning of our communities. So Ubuntu was the most suited overarching philosophy for this research, focusing on Indigenous African participants in New Zealand, even though they originated from different countries in Africa. Ubuntu embraces multi-realities. The application of Ubuntu in this research created opportunities for multi-realities to be explored and new understanding to emerge, as was informed by those with the lived experiences of neurodiversity. The values of Ubuntu are fluid and adaptable and applicable to all communities. As a value-based philosophy, Ubuntu thrives when accomplishments in the best interest of the people are attained. In this research, these are the neurodivergent Indigenous African migrants and their families. The application of Ubuntu has provided innovative recommendations and an immeasurable potential in pioneering contemporary solutions for the betterment of neurodivergent individuals and their families here in New Zealand. So now we'll have a look at the methods. So as a culturally responsive research, the first steps of this research were invested in consultations and creating connections with the communities. The research advisory group was instrumental in conceptualizing this research topic and providing guidance on every step of this research. The several community leaders that I engaged with also provided guidance and particularly around engagement with their communities. I also had consultations with Maori experts and academics for guidance on critical Indigenous theories and how to apply that expertly. as well as issues around cultural safety and how to go about just Indigenous research as a whole. So data was collected through semi-structured interviews with parents of neurodivergent children, with African migrant community leaders, and a few child and health specialists. Data was analyzed using the general inductive thematic analysis. So moving on to the findings of this research. Four main themes emerged from the analysis, but then what I just want to make clear was that as much as I tried to separate them into four parts, you find that the findings or the themes are actually intertwined, like the sort of overlap, or they are weaved in together. The experiences of neurodivergent children, from their families' experiences, from their experiences with the seeking services, from their experiences in the school and with the health specialists and so forth. So yeah, I'll try and just explain each of those themes. So neurodiversity and the sense of belonging. I think most of the participants mentioned issues around stigma and how they felt that that affected their sense of belonging and their participation in the society. On the screen there is a quote from one parent who was explaining their experiences with stigma of their autistic child, and their experiences in public. And I think similar experiences were reported by most parents. So because of that stigma, most parents would opt to, stay indoors or, keep their children away from engaging in the public because of that fear of how society would judge them or how people would look at them, or, the comments that people would pass. So in the end, they would lose out in participating in the society, and their children will also miss out on enjoying time outdoors. So another main theme was positioning neurodivergence. So I guess what came out, I guess this is also linked to issues around indigeneity, people's way of doing and their way of being and their way of understanding and so forth. So what I found was that different people understand and perceive neurodivergence differently, and that informs the strategies that they intend, like the strategies that they are willing to, take up, or the services that they are meant to seek for their children and all sorts. However, in saying that, there wasn't always complementarity of understandings. So you'd find that parents would have a different understanding, healthcare professionals would have a different understanding, and then there wouldn't be consensus. So everybody was interested in having, what is best for the child. But then most parents felt that they weren't quite listened to, because they felt that their own understandings of their own understandings of their children's condition and how they could be helped were not always appreciated, or were not always taken into consideration by the health professionals. So that was one. And then the other one was the different understandings in what is normal child behavior and what is not, because there are things, so because most of these parents grew up in outside New Zealand, so they've had, other experiences of raising children, or how they grew up in Africa, and all of those things. So what perhaps they would see as normal child behavior was what perhaps was being picked out as, as an indication of neurodivergence or stuff like that. So some of the parents really found that very difficult to swallow. So here we have an example of a parents talking about their child's behavior, of what they would call normal child behavior. Moving on to another theme. So looking at the lived realities in general, what we find is that for all the families that I spoke to, their experiences with neurodiversity are very complex. So everything about their experiences was quite hard. I think the biggest thing was the constant need to advocate for their children's needs. So it was very hard to get adequate information for where to find services, especially services that aligned with their culture, aligned with their beliefs, because I think there was a huge misalignment between what parents desired for their children and what was actually available. That said, there were also gaps in information so getting the information to help them find suitable services. So most times parents would just have to, search for themselves, either over the internet or call someone or things like that. But then it was a very exhausting thing to be doing. So even if you want more respite days, you need to advocate for it. If a child needs, like a certain support from school, the parent has to advocate for it. If the parent doesn't do that, then no one will do it. So here, this is where this mother was coming from, where she was talking about the challenges that she went through when she was advocating for her child's needs through different places for the child to get their entitlements. So something that you'd expect that, because this child is autistic, they are, entitled to these things, but then they don't come that way. So parents had to advocate for that. So the other theme was in looking at an insight into the services. So the parents and even the community leaders spoke of how it was very challenging to navigate the health system in New Zealand. So what we have on the screen there is a child specialist who's actually confirming that the system is very fragmented and very difficult to navigate. So other than having a lot of different organizations that are quite piecemeal, you don't have assessments or things like that happening in the same place. So you have parents having to be moved all over the city for different appointments, with different assessments, with different people. Often those appointments take really long to be done. So somebody has to go and, take time off work to be able to go to that appointment. And then after that, maybe they get a referral to go somewhere, and the waiting periods were so long. So I guess that was one of the biggest challenges as well, looking at the adequacy of the services. So I think the specialist also spoke about how the system was chronically underfunded, and that was affecting the services that they would have desired to give to their patients. So that impacted the support that parents could get. That had an impact on the long waiting periods. So adding on to that complexity that parents were then, expected to deal with. So sometimes even perhaps when they were advocating for stuff, it was hard to get something, maybe due to those limitations in funding or funding constraints that meant that, the services available would be very thin. So a cross-cutting finding across all the main themes was intersectionality. So intersectionality further complicated the lived realities of neurodivergent African migrants and their families. Intersectionality recognizes that identity markers do not exist independently of each other, and that each informs the others, often creating a complex convergence of oppression and discrimination, and also privilege in some instances. So in this research, what we found is that the more identity markers somebody has, the more complex their experiences were. So the impact of Black body racism was evident in the experiences of most of the African families that I spoke to, especially when they were seeking services. So you get to see that racial microaggressions, ethnic bias, and discrimination were common experiences amongst all the participants. So to summarize the lived realities, what we have in the middle there are the common experiences. Again, to reiterate that these experiences are all weaved together as much as I try to, separate them out or pull them out. So what we can see in this slide is that in the middle there are the common experiences of neurodivergent African migrants and their families. So these experiences were more or less similar across the families that I spoke to. However, the outcomes of their experiences varied significantly. So what we see on my left-hand side of the screen, for families who lived in isolation or felt lonely and had a lack of sense of belonging, their realities were often quite hard. So combined with those complexities that I spoke of that came with intersectionality, some parents ended up just accepting their child's neurodivergence as fate. So this was especially challenging when parents felt they couldn't do anything about their situation or were without hope that anything good would come out of their experiences. So this was a demotivation from seeking services. So it sort of served as a demotivation to just say, oh, well, this is what we have. What else can we do? On the other hand, for families who felt there was some sense of belonging, who felt, they had peer support and, they felt that, they could persevere. They felt they could continue advocating for their children. They felt there was hope in all of that. And then that is where we see that, Ubuntu had sort of emerged, or where they believed they had that belongingness. Their experiences, they sort of, it was sort of a positive adaptation. For families who had reliable community support and networks and felt a sense of belonging, they were more resilient. Perseverance and determination to see their neurodivergent children thriving and the hope for a better future pushed parents through their experiences with neurodivergence. We also see that Ubuntu and African ways of relationality were adapted in Aotearoa and contributed to positive experience and resilience for most parents or for most families. In terms of recommendations, I guess for the highest impact factor to be attained, holistic and responsive services that are flexible enough to accommodate Aotearoa's population's diversity should be put in place. And I think there are quite a few ways in which this can be attained. So this can be possible by putting into consideration or taking into consideration some of those ideas highlighted on the screen. First of all, having intentional collaboration with neurodivergent people to be included in the development of services that they need, not to develop something for them without them. the inclusion of diverse ways of understandings and ways of seeing and understanding neurodivergence is a very useful way of having inclusive services, and also a useful way of developing innovative mechanisms of managing neurodivergence that are outside like the Western or mainstream kind of services. Improved reporting of neurocognitive conditions in terms of data collection and data reporting. That is useful and will be very relevant in ensuring that adequate funding is provided. Or we also need a government to commit to the provision of adequate funding, and you can only keep them accountable, or keep them accountable if we have the actual figures of these are the number of people we have, this is the support they need, and this is the money that we require. I think to help manage the fragmented healthcare system, I guess it's important to improve coordination and collaboration within government departments, as well as between them as well, to make referrals between departments easier and quicker, and not frustrate the parents. So yeah, I guess in a nutshell, those are some of the recommendations. So just to end this presentation, it's just bringing back the values of Ubuntu, to say that my humanity is bound up in yours, for we can only be human together. This is a quote by Desmond Tutu. So I guess it also speaks to us in our communities, in our service provision, in all of those things, that whether neurodivergent or not, or whether whatever is happening really doesn't separate us from each other. We are all bound together. And when we look at the ethical concepts, or the ethical nature of Ubuntu, it means that if somebody else succeeds, then we all succeed. If somebody is struggling with inequities, then we are all struggling with inequities. So yeah, I'm hoping that through this presentation of mine, perhaps new ideas or new thoughts have been ignited in you, so that we can think of other ways in which we can advance. Thank you.